എന്തുകൊണ്ട് IELTS ആൻഡ് OET കോച്ചിങ്ങിന് 1,00,000-ലധികം വിദ്യാർത്ഥികൾ കഴിഞ്ഞ 9 വർഷമായി അജിനോറ തിരഞ്ഞെടുക്കുന്നു എന്നറിയണ്ടേ? അത് അവരിൽ നിന്ന് തന്നെ കേട്ടാലോ?
അജിനോറിലെ ട്രെയിനേഴ്സ് എല്ലാവരും നല്ല ക്വാളിറ്റി ഉള്ളവരാണ്. അവർ നമുക്ക് ഇൻഡിവിജ്വൽ കെയറും തരും.
അജിനോറയിൽ റെഗുലർ മോക്ക് ടെസ്റ്റ് നടത്തുന്നുണ്ട്. പിന്നെ ഓരോ സ്റ്റുഡന്റിനും കറക്ഷനും പറഞ്ഞു തരും. അങ്ങനെ നമുക്ക് പെട്ടെന്ന് ഇംപ്രൂവ് ചെയ്യാം.
നമ്മൾ പഠിക്കുന്നതിനനുസരിച്ച് നമ്മളെ ഫൗണ്ടേഷൻ.
എന്തുകൊണ്ട് IELTS ആൻഡ് OET കോച്ചിങ്ങിന് 1,00,000-ലധികം വിദ്യാർത്ഥികൾ കഴിഞ്ഞ 9 വർഷമായി അജിനോറ തിരഞ്ഞെടുക്കുന്നു എന്നറിയണ്ടേ? അത് അവരിൽ നിന്ന് തന്നെ കേട്ടാലോ?
അജിനോറിലെ ട്രെയിനേഴ്സ് എല്ലാവരും നല്ല ക്വാളിറ്റി ഉള്ളവരാണ്. അവർ നമുക്ക് ഇൻഡിവിജ്വൽ കെയറും തരും.
അജിനോറയിൽ റെഗുലർ മോക്ക് ടെസ്റ്റ് നടത്തുന്നുണ്ട്. പിന്നെ ഓരോ സ്റ്റുഡന്റിനും കറക്ഷനും പറഞ്ഞു തരും. അങ്ങനെ നമുക്ക് പെട്ടെന്ന് ഇംപ്രൂവ് ചെയ്യാം.
നമ്മൾ പഠിക്കുന്നതിനനുസരിച്ച് നമ്മളെ ഫൗണ്ടേഷൻ, അഡ്വാൻസ്, പ്രീ എക്സാം എന്നിങ്ങനെ ബാച്ചുകളാക്കി കോച്ചിങ് നൽകുന്നു.
ഒരു എക്സാമിന് വേണ്ടി മാത്രമല്ല അജിനോറയിൽ കോച്ചിങ് നൽകുന്നത്. നമ്മുടെ ഒരു ഓവറോൾ കോൺഫിഡൻസ് തന്നെ ഇംപ്രൂവ് ആകും.
എക്സാം ക്ലിയർ ചെയ്ത് പ്ലേസ്മെന്റ് അജിനോറയിൽ നിന്ന് ചെയ്യുമ്പോൾ എക്സാം ഫീസും ട്യൂഷൻ ഫീസും രണ്ടും റീഫണ്ട് കിട്ടും.
That's it. Download Ajinora Learning app now. Ajinora. Get set fly. എന്തുകൊണ്ട് IELTS ആൻഡ് OET കോച്ചിങ്ങിന് 1,00,000-ലധികം വിദ്യാർത്ഥികൾ കഴിഞ്ഞ 9 വർഷമായി അജിനോറ തിരഞ്ഞെടുക്കുന്നു എന്നറിയണ്ടേ? അത് അവരിൽ നിന്ന് തന്നെ കേട്ടാലോ?
അജിനോറിലെ ട്രെയിനേഴ്സ് എല്ലാവരും നല്ല ക്വാളിറ്റി ഉള്ളവരാണ്. അവർ നമുക്ക് ഇൻഡിവിജ്വൽ കെയറും തരും.
അജിനോറയിൽ റെഗുലർ മോക്ക് ടെസ്റ്റ് നടത്തുന്നുണ്ട്. പിന്നെ ഓരോ സ്റ്റുഡന്റിനും കറക്ഷനും പറഞ്ഞു തരും. അങ്ങനെ നമുക്ക് പെട്ടെന്ന് ഇംപ്രൂവ് ചെയ്യാം.
നമ്മൾ പഠിക്കുന്നതിനനുസരിച്ച് നമ്മളെ ഫൗണ്ടേഷൻ, അഡ്വാൻസ്, പ്രീ എക്സാം എന്നിങ്ങനെ ബാച്ചുകളാക്കി കോച്ചിങ് നൽകുന്നു.
ഒരു എക്സാമിന് വേണ്ടി മാത്രമല്ല അജിനോറയിൽ കോച്ചിങ് നൽകുന്നത്. നമ്മുടെ ഒരു ഓവറോൾ കോൺഫിഡൻസ് തന്നെ ഇംപ്രൂവ് ആകും.
എക്സാം ക്ലിയർ ചെയ്ത് പ്ലേസ്മെന്റ് അജിനോറയിൽ നിന്ന് ചെയ്യുമ്പോൾ എക്സാം ഫീസും ട്യൂഷൻ ഫീസും രണ്ടും റീഫണ്ട് കിട്ടും.
That's it. Download Ajinora Learning app now. Ajinora. Get set fly. എന്തുകൊണ്ട് IELTS ആൻഡ് OET കോച്ചിങ്ങിന് 1,00,000-ലധികം വിദ്യാർത്ഥികൾ കഴിഞ്ഞ 9 വർഷമായി അജിനോറ തിരഞ്ഞെടുക്കുന്നു എന്നറിയണ്ടേ? അത് അവരിൽ നിന്ന് തന്നെ.
Hi all. Good morning, everybody. Hi, Fessy. Hi, Anjali. Hi, everyone. So today we are dealing with the writing module in OET. We have lots of videos about all the modules in OET in this page. So those who are thinking about OET and planning to write OET can make use of these resources for free. It will take long time if we discuss everything about OET writing module. We have done those videos before. Now today we are focusing on the selection, organization and transformation of a case note. Selection, organization and transformation of a case note into a letter format. So we will do that with the help of a case note, and we'll go through that letter after on. So as you all know, we have 5 minutes for reading and 40 minutes for writing. What we do in that first 5 minutes, that's the time we need to look for some different things. Then we start writing in the next 40 minutes. That's the way it is OET writing module. What are the types of OET letters? What are the type of OET letters? As we all know, there are 3 types of letters in OET. There are 3 types of letters. They are referral letter, discharge letter and transfer letter. these are the three different types of letters that we need to write, especially nurses and doctors. So it is very important to recognize what type of letter is this, then only we can use the appropriate verb in our introduction. So that is what we are going to do in that first 5 minutes. Okay, so there are three types of letters: referral letter, discharge letter and transfer letter, and we should recognize what type of letter it is in this 5 minutes. What are the other things we need to look for in that time, that first 5 minutes? What are the next things we need to look? They are, who are you writing to? That's the first thing we need to look for. Who are you writing to? Where will we see that information? It will be there in our writing task. So we can see that information in the writing task. Writing task will be the end part of case note. We all know that. So the first thing we need to look for is, who are you writing to? Then the next thing is, why are you writing to? Why are you writing? There will be a purpose. There will be a few things that the reader is going to carry out for this patient. That is the purpose of our letter. So that's what we are going to look first. Why are you writing? So it should be there as well in our introduction part. That's what we're going to look in that 5 minutes as well. Then the next thing to look for is, do they know the patient? That's a very important thing to know before we start selecting and organizing our case note, because then only we can select the relevant case note for this letter, because there might be some existing relationship between this patient and the reader. If there is an existing relationship between the patient and reader, the case note or the relevant data is going to be different. There's no point writing the data that the reader knows. There's no need to repeat that again in our letter. So it is very important to know that, do they know the patient? So when we get the letter, we are not supposed to write anything in that first 5 minutes. So this is only for reading. At that time, these are the first things to look for. Who are you writing to? Why are you writing? And do they know the patient? Okay, so it will be given in the writing task. Always the first answer will be there, who are you writing to? So the writing task is going to be, write a letter to patient's GP or whoever it is. It will be in the writing task. Then the next question is, why are you writing to? Usually it will be given in the writing task as the that is the end part of the case note. Sometimes we might find it difficult to see that there in the writing task. If that's the case, you will find that information just above the writing task as the end part of the case note. Again, it will be there as the end part of our writing case note. Okay, then do they know the patient? That's what most of the students ask such a question always, like, how we know that it's a known case or not? Do we need to assume that by reading the case note? That's a very common question, but OET always says that in official OET case note there won't be any such confusion. There won't be such a confusion because it will be clearly given in the writing task, like Mr. X's doctor or Mr. X's GP or Mr. X's family nurse or whatever. It will be given clearly in the writing task. That means it's not a thing that students need to assume and write. It will be given clearly in the writing task. I'm saying about the official OET writing case notes. I'm saying only about the official OET case note. when we practice, we don't have that much materials to practice, so we sometimes use unofficial practice materials and self-prepared practice materials and things like that. In such case notes, we might have such confusion like, is it a case known case or not, but OET declares that there won't be any such confusion for students. It will be clearly given in the writing task. So if there is like that patient's GP or patient's nurse and things like that in the OET in the writing task, definitely it's going to be a known case, otherwise it's going to be a new patient for that reader. Okay, so these are the things to look for in that first 5 minutes. Then our writing time starts and we have 40 minutes time to write. It is a nice way to divide that writing into 3 steps to make it easier. It is a nice way to divide it into 3 steps. Those three steps for that is selection, organization and transformation. If you try to write it in that way, we can manage that 40 minutes easily, and we can finish our writing 5 minutes early, and we will get time for proofreading and things like that. So selection, organization and transformation are the 3 different stages that is very helpful to write a letter in time, to finish it in time. Try to do this way, try to follow this way, and it will help students to write or make use of their 40 minutes very effectively. So the first step is selection of case note. The first step is selection. How to select the case note? When we go through a case note, we can see that there are 3 types of information in the case note. There will be 3 types of information in the case note: relevant information, semi-relevant information and relevant information. Selection of this data depends really on the reader. If they have an existing relationship or if it is a known case, this selection is going to be different. If it is a new case, it is going to be different again. Okay, so what is the relevant data for the reader? We have to recognize what are the information needed for the reader to continue that care for the patient. So the reader should stand there in front of us when we select the relevant data. When we go through the case notes, we can see that some of the data is very important for the reader to continue the care. He should know that information to continue the care. If that's the case, we should include that in our letter. There may be some information that we might be thinking whether we need to include it or not. We might be confused. Will I include it or not? There will be some notes like that. They are known as semi-relevant information. When we just put a mark there beside it, and when we write the letter, if we get a space to include that information, and if we really feel like we are going to include that information, we can include that and we won't lose marks for that. Okay, so this is about semi-relevant information. The next thing is irrelevant information. When we go through the case note, we see a lot of irrelevant information, and we know that this reader doesn't want to know this thing to continue the care for this patient. If that's the case, just cross it out and exclude that information from our letter. Sometimes we forget that we have 7 marks for that. We have 7 points for exclusion of irrelevant data from our case note. When we go through the marking criteria, we have done a video about the marking criteria of writing module before, and it is available in this page. So if you are thinking about OET, you can go through it and make use of all those resources for free. So I'm not going to go into detail about the marking criteria in this session. Now there is a marking criterion, that is conciseness and clarity. That is the third marking criterion, and these 7 marks are for exclusion of irrelevant data. That means to score that 7 points, we should exclude the irrelevant materials from our case note. That means we will definitely have irrelevant information in our case note. They should include relevant information in the case note. Then only they can give us these 7 marks. So it is our responsibility to recognize that relevant information and exclude it from the case note. Sometimes we forget that, so we may include, like if the, for example, if the patient is a heavy smoker and a drinker, sometimes when we are writing it to a physiotherapist for physiotherapy assistance and things like that, we might be thinking it is a problem for the patient because he drinks and he smokes. It is a problem, so we will have a tendency to include that information in our letter. Then we are going to lose our mark. So it is very important to realize that we have marks for that exclusion of relevant data. So I'm saying about this irrelevant data, this exclusion of irrelevant data more and more, because I see lots of students forget that when they write the letter. They try to include all this relevant information that will they can't finish their writing in that 40 minutes time, and they won't get time for proofreading, and they're going to lose mark for this. So these are the 3 points that we see in the case note. It is our responsibility to include the relevant information that is needed for the reader to carry out the care for the patient. Okay, so that is the first step. Select the relevant data. We do this in that 40 minutes time, so we can use our pencil or pen and we can mark it in our case note. I'll show you that later on when we go through the case note. So it will be easy to include in our letter when we start writing. Okay, so we move to the next session of the next stage of the writing. It is organization. So this is the part students find it very difficult to complete. Organization. We know how to select the relevant data. We know what the reader needs to know to continue the care for the patient, and we know everything. We know it's an on case or not, but the thing is, we don't know what to put where. That's the problem. That's the problem students face most of the time. So organization, to know about organization is very important. We can divide it into 2 or 3 way when we think about organization. One method is organize things in chronological order. That means in the number of if for example, if there are lots of visits in the case note and there are 4 or 5 visits, and all this happened in the last 6 months or 1 year, there will be lots of information. We can't include all those details in our letter, but we are going to arrange or organize those things in that order, in that chronological order. This is a nice way of writing. So if that's the case, we may write Mr. X visited the health center in December 2022 for the first time. Initially, Mr. X visited the health center in December. Then 2 weeks later he had another visit or whatever. Last time when he visited, his condition was worse or whatever. Today he was brought to the emergency department with this and this. Okay, so we order or we organize that events in a sequence. That is one way of organization. If there are a number of dates and things like that, that's the way we are going to follow to organize the letter. Another way of organization is in the order of importance. Why this patient is here with us, what happened to him, what's his present condition, that is the important thing for the reader to know. So we write that as the first paragraph. Then we may write the social or past medical history, the relevant history in the next paragraph. Then we go to the request paragraph. So this is another way of organization. So one important thing to remember when we think about organization is, if it is an urgent letter, like if there is a word like urgent, immediate, or immediate, it is going to be or emergency, it's going to be an urgent letter. In this situation, please remember to write down the present condition of the patient as the first paragraph. Just after the introduction, it is very important to include the present condition of the patient. So at that time we can't write it in chronological order. It has to be the present condition of the patient in the first paragraph. Then we can go to the history of the patient. It has to be like that. That's what OET says all the time. Okay. If it is or in all other situations, we can order or we can organize the case note according to the order of importance. Today the letter we are going to deal with, I just organized that letter in the order of events. I'll show you that later on. So this is the two types of organization that we can follow to make the reader clear about what we are writing. It has to be in simple terms. When we think about organization, a simple word to remember is it has to be like a story. If we think like that, it will be easily clear for the, it has to be like a story. It will be easily clear for the reader then. Try to simplify or try to make a one-line story about that case note. Try to think about a one-line story of that case note and try to make it as a story and write that letter in a simple way, so our reader can easily understand what's happening for this patient and what he is going to do for that patient. So that's all about organization. Now third stage is transformation of this case note into sentence. So transformation of case note into full sentence, that is an important part of our letter writing. Okay, now we are going to look at the case note. This is the case note we are going to discuss today. Some of you might have seen this case note. Our patient is George Gale. So our exam time starts now, and it's the start of it's a start of 5 minutes. This is the first 5 minutes reading time. What I'm going to do is I'm going to go to the task to see. That's what I said before. What are the things to see first? The first thing I'm going to look for is who is my reader. So it's clearly written there. Write a letter of discharge to Miss Cole, the head nurse in a nursing home. So I'm going to write to a nurse. Now I'm clear that I'm going to write this letter to a nurse. Then I'm going to look for what is the purpose of writing. It is clearly given there, like Mr. Gale's history as well as your concerns and recommendation. So that's what I'm going to write in the letter, Mr. Gale's history as well as your concerns and recommendation. But still it's not clear that why am I writing this letter. I'm not just writing to outline this, that's what I'm going to include in the letter, but this is not why I'm writing this letter. If I can't find that information in the writing task, but I'm going to look just on the top of the writing task. There it is given, ready for discharge to nursing home for temporary care. Okay, so he is going to that nursing home for some kind of form of temporary care. write to head nurse at nursing home regarding further care required. So it is clear there. Now I'm clear that that's the reason I'm writing this letter. Okay, so as I mentioned, these are the three things to look for. Who am I writing to, why I'm writing this letter, and there is another thing, is this a known case, or is there any relationship between the reader and the patient. It doesn't say Miss George's nurse or anything like that. That means it is definitely a new case. There's no clue about any relationship between the reader and the patient in the writing task. That means it is a new case, so I don't need to worry about such things. Now I'm clear that it is a new patient for this head nurse, and this patient is going to that nursing home for temporary care, and what I am going to write is his history as well as my concerns and recommendation for this patient. Now I have a clear picture of what I am going to look for in the case note. Okay, so we start from the beginning, and it says today's date, that's very important, is 15th May 2021, and you are a nurse, so I'm a nurse responsible for the care of this patient who was admitted after a fall. He is now ready to be discharged. So he was with us, I don't know how long, he was with me, he was under my care, and now it's time for discharge, and he is going to a temporary care. I don't know why. So that's what I'm going to look in the letter. So George Gale and his date of birth and year. Usually date of birth and year, age will be given as years as well in the case note, and his address is there. Okay, and I'm going to go through all those things in that 5 times roughly to see what's happening, and we'll get 5 minutes time, and we'll get time to read the case note only once, maybe twice in that first 5 minutes. We don't get much time to do anything, and we can't use pen or pencil at that time. So we just go through the case note, and understand these things. Okay, then we are going to use our pen to mark the things. I marked the first questions already. Now you are going to mark those things in your case note, because this is the time to do such things. Okay, now what I'm going to do is I'm going to recognize the relevant information and put a tick mark there for the relevant information. If there is any doubts about some points, I'm going to put a query mark there, and if it is an irrelevant information, I'm going to cross it out in that first reading itself. So this is my 40 minutes time. I'm going to mark the relevant data and irrelevant data in this case note. Okay, so definitely I need the name of the patient, age of the patient, and I don't need the address, and his social background, retail manager, I mightn't need that information. Widower, wife died 2019, so widower is an important information. That's why he has no one to look after him. That may be the reason for his transfer to this temporary care. His son works abroad, I don't care. No family close by, it is important, but there is another point like living alone. So I'm going to include only that part of it in my letter, because that's the important thing that nurse wants to know. So he lives alone in his own flat. Doesn't matter if it is level 2, no lift, because he is not going to go there. He is going to go to that nursing home. Socializes with neighbors, no, I mightn't need that. Independent, cooks daily, walks to shop, that's his condition. So he was totally independent, but he is not going to do any of these things now, because he is moving to that nursing home. So I don't need that, sorry. So I don't need that information. Social drinker, smoker, 10 cigarettes per day. He's going to that nursing home only for a short time. That means this is this doesn't matter for that nurse to continue the care. I'm going to put a query mark there, and I'll see do I need to include that information in the letter. Okay, then we go to the medical history of this patient, and it says he has this and some gastroesophageal reflux, self-treated with antacid tablets. So it says self-treated with antacid tablets, so that nurse doesn't have anything to do with this condition. So I'm not going to include that information. Then 2019, he has non-specific colitis, ongoing monitoring, no treatment required. That's okay. He doesn't need any treatment, but he needs to continue this monitoring for this condition. So I'm going to include that information as well in our letter. And he is taking this paracetamol and felodipine, and the doses are given there. I might not mention that doses. I'll see when I go through, because he is taking these medications for a long time and he can manage it on his own. So I might not include the dose and things like that for the nurse, because this patient is managing all his medications on his own. So he will do that when he is in the temporary care, but I'm going to tell the nurse that he is taking all these medications. Okay, now presenting complaint, that's his present condition. He disorientation and fever following A4. That's why he is here with us. Then it says the hospital admission history on 10th May. Okay, so today is 15th May and he was admitted on 10th May. And there are subjective and objective data there. The patient reports fall on 9th May. Subjective data is that's what patient says, and objective what we see in the patient. So subjective data is he reports fall on 9th May while brushing teeth. Doesn't matter, felt big, legs give away. We don't need to explain such things. Fell backwards with head strike. That's an important point. I'm going to do that. And approximately 5 hours lying on the floor. There will be a reason for that, because he lives alone. That's why he was there for 5 hours. Neighbors heard call for help around 3:10 May, called ambulance. That's important, isn't it? That's why he has no one at home. That's why he was there for 5 hours after his fall, and neighbors heard only after few hours, and they called the ambulance. They brought the patient in. So we need to tell that story, not in detail, but we need to tell what happened to that nurse to understand the condition. Then only she will realize why this man is coming to her for temporary care. Okay, so I'm going to include that information. 2 weeks before fall, single episode of vomiting, palpitation and dysuria. Okay, there is something going on for that patient. That's why he had the same episode 2 weeks ago as well. I'm going to include that information. Then when we observed the patient on 10th of May, he had confusion, disorientation, and his vital signs were like this, and his urinalysis was like this. That is the objective data of 10th of May. That was 5 days ago. So these values don't have anything to do anymore. So we don't need to mention those values to that reader, because she doesn't have anything to do with it, and he was treated with us in the last 5 days and he's fine now. He is not that bad. So these readings has nothing to do with this our reader. So I'm not going to include that information there, and his diagnosis is very important. So I'm going to include that as well. Okay. Then there is the treatment record 10th to 14th. That was until yesterday, because we are writing it today on the 15th. So he got IV antibiotics, amoxicillin 1 into 758 hours, and patient's regular medication continued. We know what are the medications, and he got IV antibiotics, but it is finished now. So I'm not going to mention the name and dose and things like that. I may mention just IV antibiotics in the case note. that will do for the reader, because she is not going to deal with that IV antibiotics. So just want to know he got antibiotics. She doesn't want to know the name or anything about the medicine. Then observation, nil dizziness, nil palpitation, and readings again. That means it's all normal. Yesterday it was all back to normal. Okay, so I'm not going to write down that. I can just say patient is stable right now. Okay. And today is 15th of May. He is ready for discharge to nursing home for temporary care. That's why he is coming or going to that nurse. And here it says concerns. This is what I am going to write down in my letter. What are the concerns? He lives alone, no home help, keen to return to own home as soon as possible. Keen to return to home as soon as possible, because in the first part of the letter they said that he was very independent. He went to the shops on his own. He did all the shopping and he did everything himself. So he's a kind of independent all the time. So he doesn't want to be in a care. He wants to go to on home as soon as possible, but right now he is not in that position. That's why he is coming to you. Please keep an eye on him for few days and you can send him back. That's what we are going to say to that reader. Okay, then the next thing is significantly lower mobility, 30 minutes per day of physical activity to be encouraged. That's what our reader going to do. So that is the main request for the reader, to help him to regain his physical strength to return to his home. That's what she is going to do. Still episodes of confusion, so assessment for independent living recommended. Okay, so we can connect that because he still has episodes of confusion. That's why he is going to that temporary care, and he wants to go home as early as possible. Before that, an assessment for independent living is recommended. Then only we can send this man to your or her care. Now I went through the case note and I marked everything that I needed to include in the letter. Now I know what is the content in my letter and what the reader wants to know to give that care, and what are the things I'm going to exclude from this letter and things like that. Now I know everything and I'm going to start write my letter. Okay, I'm going to start. Before that, it will take 5 to 7 minutes to do these things. Maybe if it is a complicated case note, it might take 10 minutes to array, select, organize and do all these things. Sometimes it will take long time. It doesn't matter. It is better to spend that first few minutes to do all these things. If we start writing only after that, we can make use of our 40 minutes very effectively. So it is very important to spend that time to do all these things before we start writing. Okay, now it is time to start writing our letter. After that 7-8 minutes, we can start writing our letter. So this is the letter format. This is the common format that we follow for OET writing. We can write address as the first part if we need, and date as the second bit. We can do the other way around as well. These both formats are right according to OET. We can write date there if we need and then the address here. It is kind of interchangeable. It doesn't matter, but it should be there. When we write down the address, we are copying it from the case note, so it should be correct. You should copy it correctly in the right spelling. That's the main thing. It has to be in right spelling. We might lose marks for spelling mistake here because we are copying it from our case note. So address and date, then the salutation. We can if there is a name, the salutation has to be the name. If there is no name, then only we can use the designation as the salutation. Okay, then patient's name and date of birth. According to OET, we can change this like this as well, but we normally follow this way, salutation first and then the reference line. So it is easy to do that in the same way. Even if you forget to do the salutation first and wrote the reference line, you can write the salutation as the next line. It's also right. According to OET, this is also right, but just try to follow the way that you learn or practice. Okay. Now it is time to think about introduction, because we didn't spend any time for that introduction. We were going through the case note, we selected the relevant data, and now we know what is the content of our letter, but we didn't spend any time for our introduction. Now it's time to spend 2 to 3 minutes to write our introduction. When I say 2 to 3 minutes for introduction, I know it's a bit long time to think about introduction, but it is very important to spend at least 2 to 3 minutes to make a nice introduction. As we all know, first impression is the best. So try to make a nice introduction and spend few minutes for that. Here it is like, thank you for taking over Mr. George Gale's post-fall care. Thank you for taking over Mr. George Gale's post-fall care. I'm writing to provide a brief summary of his background and plan for temporary residential care upon discharge. Okay. So it is a nice way of introducing a patient to a reader. I don't know how many of us are comfortable to use this start, thank you for seeing or thank you for accepting as the introductory sentence, because this is a nice way of writing. This is a nice way of writing a formal letter. Maybe especially in Western countries, it is a kind of anticipatory thank you. They are thank youing for carrying out the care for this patient. That's why they start the letter like, thank you for taking over Mr. George Gale's post-fall care. Or you can say, I'm writing to transfer Mr. George Gale for post-fall care or for temporary care. That's the way we are. I'm writing to refer, I'm writing to transfer. This is the common way used. Here we can use thank you. I'm writing to transfer Mr. George Gale for temporary care. That's also right. There are different ways of introduction. We can't say this is the right way, this is the wrong way. There's nothing like that. It's totally kind of personal preference. Okay, thank you for saying, thank you for accepting. All these terms are very good usage to start our introduction. So try to practice such nice terms as well. If you go through the official OET sample letters, you will see lots of letters like that, starting like that. So it is a nice way of writing, and if you can practice it well, when you practice you can easily use it on the exam day. Okay, then I'm writing to provide a brief summary of his background. Where did I get that information? That's why I'm writing. Where did I get that information? I saw that in the writing task. Outline a brief history of that. That's what it says in the writing task. That's why try to use a kind of same word from the writing task in our introduction part, because it will be given clearly that what we are going to include in our introduction or as the purpose. It will be clearly given in the task. Try to use or paraphrase those terms in our and use it in our introduction. That's why here it is written like, I'm writing to provide a brief summary of his background. That's what it says. Please outline history of his background. Here we say I'm writing to provide a brief summary of his background and plan for temporary residential care upon discharge. There it says give your recommendation, give your concerns and recommendation. That's why here it say plan for temporary residential care upon discharge. So this is a perfect introduction for that reader. By reading this, she'll understand what it is there in the letter and what I'm going to do for this patient. Okay, so she'll get a picture of what's going on by reading the introduction itself. Now we think about the organization of this selected case note. So I said one way is chronologically, so there's nothing to write like that in this case note because the events that happened or the dates that happened have no importance in this letter. So it can't be, I can't organize this letter in a chronological order. So it is better to write it in order of events. That will make more sense for the reader. So that's the way I'm going to follow today. In this letter, that's the best way to organize this letter. Okay, so in this letter, as the first paragraph, we are going to write down the important thing first, and it says Mr. Gale, an 85-year-old widower, lives alone in his own flat. That is the context. I can't go forward without saying that because that is his situation. That's why everything happened. So I have to give that as a context, and that's why I wrote that sentence as the first sentence. See, an 85-year-old widower lives alone in his flat. This is a nice way of writing sentences in our OET letter. This is a nice way of giving additional information in the comma. Okay, this is an additional information, but it is an important information because he is an aged man and he is a widower. That's why he lives alone. So it is an important information. Instead of writing another sentence for that, I'm just trying to include that information as the additional information. So Mr. Gale, an 85-year-old widower, lives alone in his own flat. On 9th May, he had a fall at home and hit his head. So that's the story. It was not till several hours later that his neighbors heard his cry for help and called the ambulance. That's where the delay was. That's why he was late to come to the hospital. Mr. Gale later said that he had suddenly felt very weak before he collapsed. That's what happened to him. When he was conscious, he said that that's what happened to him. There it is a nice way to use this past perfect tense. He had suddenly felt very weak before he collapsed. These are the types of sentences that we need to report past events, and that makes more sense for the reader. She'll get a clear picture of the sequence of events. So try to make or write or practice such sentences, and it will make or it will give clear idea about what happened when and things like that for the reader. So this is a nice way of writing again. That's what OET recommend us to use. He reported a single episode of vomiting, palpitation and dysuria 2 weeks prior to this incident. Okay, so 2 weeks before he had all these symptoms. So this is also important because there is something going on for him. That's why this man had this problem. That's why he collapsed, and that's why he is here. So these are the things to report, to be noted. That's why we write that thing to the nurse. He reported a single episode of vomiting, palpitation and dysuria 2 weeks prior to this incident. Then he was admitted to hospital with a fever and disorientation. Symptoms later attributed to a urinary tract infection. I just underline those words, a fever and a urinary tract infection, because sometimes students forget to use those articles in front of fever, infection. We sometimes are confused about the use of articles and countable nouns and things like that. When we think about medical writing, these are the things we usually write or use in our case note: fever, infection, and we better remember that these are countable. So it is important to put that article there in front of fever and infection. That's why they put with a fever and disorientation, symptom later attributed to a febrile urinary tract infection. Okay, so that is the story. That's what happened to that man. That's why he is here. So that's the story. That's what the writing task says. It says detail some, give some background history. This is the background history. That's why we mentioned that in this first paragraph. Sometimes if we go through the writing task in detail, we will get the organization from there itself. So it will clearly say what type of organization they prefer for this letter. In this letter, that's what they give in the writing task. If you organize in that way, we can easily organize the letter in the same way. So this is the history, background information. Then there is some medical information that is relevant. She just wants to know that he has hypertension and osteoarthritis, and he takes medication for that, and he requires regular monitoring. That's why we mentioned that paragraph there. Mr. Gale has hypertension and osteoarthritis, for which he takes feldopin and paracetamol. The dose and the time and things have no such importance, because this man was taking this medication all the time. He knows how to take the medication, at what time and how. So that nurse may not be giving this medication because he can manage it on his own. That's why I'm not going to give the dose and things there in this sentence. I just mentioned that he has this condition and he takes medicine for that. He also requires regular monitoring for his non-specific colitis. When it says regular monitoring, even though it's a temporary care, it needs to be monitored in between as well. That's why we are writing or including this information as well there. Okay, so that's it. There is a small paragraph about that information. Now in the writing task, it says give your concerns and recommendation. That's what it says in the writing task. So provide the background information. We did that in the first paragraph. Then it says give your concern and recommendation. So that's my request paragraph. Here we are going to write down our concern and the recommendation. So Mr. Gale now has reduced mobility, comma, therefore he needs to be encouraged to do 30 minutes of daily physical activity to regain his strength. Okay, it is very simple. He has reduced mobility, therefore he needs to be encouraged to do 30 minutes of daily physical activity. It's clearly given as it is in the last part of the letter. So I'm just paraphrase or transforming that case note into complete sentence. That's all we did there. The next point is he has some confusion, isn't it? That's what given in the last part of the case note. He has some confusion. So we can make that sentence like, despite his UTI being successfully treated with IV antibiotic. Here I mentioned that IV antibiotic. I'm not going to say the name of the antibiotic, the dose and the time and anything, but I just said IV antibiotics. Despite his UTI being successfully treated with IV antibiotics, he still has episodes of confusion. That's the problem. He still has episodes of confusion. That's why he is coming to your care. That's why my concern is, despite he is being treated with IV antibiotic, he still has confusion, episodes of confusion. That's why he is coming to you. The next point is, although he is keen to return to his own home, that's what given in the case note. Although he is keen to return to his home, An assessment for independent living is strongly recommended prior to discharge from your facility. He needs to be assessed before his discharge. He needs to be assessed for independent living. Otherwise, because he still has confusion, he is physically still weak, he still has the chance for a fall, so it is important to assess him for independent living before the discharge. That's why we included that information there as well. Now we included all the concerns and recommendation about this man. Now that nurse knows that what is the problem going on with this man, why this man coming to our care, what I'm going to do that for that patient. Now she is clear about everything. Our letter has to be like that. She has to get a clear picture of what's going on and what I'm going to do for this patient. And the closing sentence is, your assistance would be greatly appreciated. That's a nice way of ending a letter as well. Your assistance would be greatly appreciated. So we are so used to start our request paragraph like, it would be greatly appreciated if you could. That's okay, but this is a better way than that, because that it would be greatly appreciated if you could, that's kind of 7-8 words, and it is a well-known phrase in English. There's no point including such things in our letter, so we better make our own sentences like this. Your assistance would be greatly appreciated. That's more personalized. That gives the reader or the person who evaluates, it will give more impression to them. So it is better to create our own sentences like that. So this sentence is very good. Your assistance would be greatly appreciated. And the ending of the letter, yours sincerely, nurse. Here I wrote yours sincerely because there is a name for the reader. So we better use yours sincerely. If there is no name for the reader, then you should use yours faithfully. So this is an sample letter from actually a case note from OET official website, and this is an exam letter as well. I think it was in the last year. It was an exam question paper. So this is the way we get case notes for OET writing, and this is the way they expect us to do the writing. Okay, now I hope you are clear about what about this letter. If you have any doubts and questions about anything, you can comment in the comment box, and I'll try to answer those questions this time. If I don't get time to go through all those questions, I'll answer it afterwards anyway. So if you have any doubts or any comments or questions about anything, you can ask now. And in AJINORAH we are providing excellent coaching for OET, and the last OET result proved it again, because it was nearly 100% success in every AJINORAH institutions. All our OET, most of our OET students are happy with the result, and it's not the first time. Always we are proven to be the best. So if you want expert training and coaching for OET, if you are thinking about OET, and if you are planning to write, we are here to help you to achieve your dream. And we had good results last time as well. Congratulations to all the trainers and the management of our institution for that. Also, we have Independent Day offer. Those who are struggling to write OET and to achieve their dream, we are again here to help you. So we have a lot of discounts and offers going on at the minute related to our Independence Day. So try to make use of all these things, and if you have എന്ത് സ്വപ്നം ഉണ്ടെങ്കിലും അത് അച്ചീവ് ചെയ്യാൻ ഞങ്ങളെല്ലാവരും നിങ്ങളുടെ കൂടെയുണ്ട്. അതായത് നമുക്കറിയാം ഇപ്പോൾ ഒരു ഭയങ്കര ട്രെൻഡിങ് ആയിട്ടുള്ള കാര്യമാണ് നമ്മുടെ എല്ലാവരും ഈവൻ +2 കഴിഞ്ഞ സ്റ്റുഡൻസ് ആണെങ്കിൽ എങ്ങനെയെങ്കിലും ഒന്ന് പുറത്തു പോവുക, അങ്ങനെയുള്ളൊരു രീതിയിലാണ് ട്രെയിൻ ചെയ്ത് വരുന്നത്. അതിനുവേണ്ടി എന്താ ചെയ്യേണ്ടതെന്ന് അറിയില്ല. അതാണ് ഒത്തിരി പേർക്കുള്ളൊരു കൺഫ്യൂഷൻ. എന്ത് പഠിക്കണം, എവിടെ പോകണം, ഏത് രീതിയിൽ നമ്മൾ മുമ്പോട്ട് പോയാലാണ് നമ്മൾ നമ്മുടെ ഡ്രീമിൽ എത്തുള്ളൂ, ഇങ്ങനത്തെ ഉള്ളൊരു കുറേ കൺഫ്യൂഷനൊക്കെ ഉണ്ട്. അപ്പോൾ നമുക്ക് എല്ലാ സഹായങ്ങളുമായിട്ട് നമ്മുടെ അജിനോറ ഇൻസ്റ്റിറ്റ്യൂഷൻ മുമ്പിലുണ്ട്. അതായത് ഇപ്പോൾ ഇംഗ്ലീഷ് സ്പീക്കിംഗ് കൺട്രീസിലേക്ക് പോകേണ്ടവർക്കാണെങ്കിൽ OET, IELTS. ഇനിയിപ്പോൾ ഒരു ന്യൂ ട്രെൻഡ് എന്ന് പറയാൻ പറ്റില്ല, കുറച്ച് നാളായതുകൊണ്ട് ജർമ്മനി പോലെയുള്ള രാജ്യങ്ങളിൽ ഒത്തിരി വേക്കൻസികൾ കാര്യങ്ങളൊക്കെ ഉണ്ട്. അതായത് അപ്പോൾ ഒരു ഇംഗ്ലീഷ് റിക്വയർമെൻ്റ് അല്ല അവിടെ വേണ്ടത്, നമുക്കറിയാം ജർമ്മൻ ലാംഗ്വേജ് ആണ്. വി ഹാവ് സ്റ്റാർട്ടഡ് ഓൺലൈൻ ആൻഡ് ഓഫ്ലൈൻ ജർമ്മൻ ലാംഗ്വേജ് ട്രെയിനിങ് as well. സോ ഇനി അങ്ങനെയുള്ളവർക്ക് നമുക്ക് അജിനോറേനെ അപ്രോച്ച് ചെയ്യാം. അതിന് നമുക്ക് എക്സ്പേർട്ട് ട്രെയിനേഴ്സ് ഉണ്ട്, ഓൺലൈൻ കോഴ്സസ് ഉണ്ട്, ഓഫ്ലൈൻ കോഴ്സസ് ഉണ്ട്. അപ്പോൾ അതൊക്കെ യൂസ് ചെയ്യുക. A1, A2, B1, B2 ലെവൽസൊക്കെയാണ് ജർമ്മൻ കോഴ്സസ്. അതിനിപ്പോൾ സ്റ്റുഡൻസിന് B2 വരെ എത്തണമെന്നൊന്നുമില്ല, നഴ്സസിന് B2 വരെയൊക്കെ എത്തേണ്ടി വരും. ഡിപ്പെൻസ്, നമ്മൾ എന്തിനാണോ പോകുന്നത്, എവിടെ എത്താനാണോ അതിൻ്റെ അനുസരിച്ചിരിക്കും നമ്മൾ ഏത് കോഴ്സ് സെലക്ട് ചെയ്യണം എന്നുള്ള കാര്യങ്ങളൊക്കെ. അതിനുവേണ്ടി ഹെൽപ്പ് ചെയ്യാൻ നമുക്ക് എന്ത് അഡ്വൈസ് തരാനാണെങ്കിലും അതിന് എലിജിബിൾ ആയിട്ടുള്ള സ്റ്റാഫ്, ഹെൽപ്ഫുൾ ആയിട്ടുള്ള സ്റ്റാഫ് നമുക്ക് അജിനോറയിലുണ്ട്. വരിക. അതിൻ്റെ ഒരു കാര്യങ്ങളും ഒരു പണ്ടൊക്കെ ആണെങ്കിൽ നമുക്ക് ഇതിനുള്ളൊരു സിറ്റുവേഷൻ ഇല്ല, ഓപ്പർച്യൂണിറ്റി ഇല്ല, എവിടെയാണ് ട്രെയിനിങ് നല്ലതെന്ന് അറിയില്ല, ആരാണ് നന്നായിട്ട് ഇതിനൊക്കെ ഹെൽപ്പ് ചെയ്യണമെന്ന് അറിയില്ല, അങ്ങനത്തെ കാര്യങ്ങളൊക്കെ. പക്ഷെ നമുക്ക് ഇപ്പോഴൊക്കെ എന്ന് പറഞ്ഞിട്ടുണ്ടെങ്കിൽ ഒരേ ഇൻസ്റ്റിറ്റ്യൂഷന് അവിടെ വന്നിട്ടുണ്ടെങ്കിൽ A to Z കാര്യങ്ങൾ അവർക്ക് തന്നെ മാനേജ് ചെയ്യാൻ പറ്റും. അതായത് ഏത് കോഴ്സ് എടുക്കണം, ഏത് രീതിയിൽ പോകണം, ഏത് കൺട്രി ആയിരിക്കും നമുക്ക് സ്യൂട്ടബിൾ ആയിട്ടുള്ളത്, അങ്ങനെ ഫുൾ ഗൈഡൻസ് തന്ന് നമ്മളെ കൊണ്ടുപോകാൻ വേണ്ടി ഉള്ള രീതിയിൽ റെഡിയാണ് നമ്മുടെ ഇൻസ്റ്റിറ്റ്യൂഷനൊക്കെ. അപ്പോൾ അതിൻ്റെ മാക്സിമം അതിനെ യൂട്ടിലൈസ് ചെയ്യുക. നമ്മുടെ സ്വപ്നങ്ങൾ എത്തിപ്പിടിക്കുന്നതിൽ ഒന്നും ഒരു തടസ്സമാകാതിരിക്കട്ടെ. നമുക്ക് OET ലെറ്ററിലേക്ക് തിരിച്ചു വരാം. അപ്പോൾ എന്തെങ്കിലും ഡൗട്ടൊക്കെ ഉണ്ടെങ്കിൽ ചോദിക്കാം കമൻറ്റ് ബോക്സിൽ. റെക്കമെൻഡേഷൻ, ഞാൻ കുറച്ച് കമൻസ് കഴിഞ്ഞിട്ടുള്ള ലാസ്റ്റ് പാട്ടൊക്കെ ആയിരിക്കും കാണണം. ഇപ്പം ഞാൻ കാണുന്നതാണ് ആൻസർ ചെയ്യണത്. ഏതെങ്കിലും വിട്ടുപോയിട്ടുണ്ടെങ്കിൽ നമുക്ക് പിന്നെ നോക്കിയിട്ട് റിപ്ലൈ തരാം. ഓക്കെ. റെക്കമെൻഡേഷൻ പാര യൂസ് ടു റൈറ്റ് പ്ലീസ് കൈൻഡ്ലി നോട്ട് പ്ലീസ് നോട്ട് ദാറ്റ് ബട്ട് ഇൻ ദിസ് ലെറ്റർ ഡിഡൻറ്റ് യൂസ് പ്ലീസ്. അതാണ് ഒരു ചോദിച്ചേക്കണ ഡൗട്ടാണ്. ശരി, അതാ ഞാൻ പറഞ്ഞത്. നമുക്ക് എപ്പോഴും ഒരു ക്ലീഷേ സ്റ്റൈൽ റൈറ്റിംഗ് ആണ്. നമ്മൾ എവിടെ നിന്നൊക്കെയോ കിട്ടിയ കാര്യങ്ങൾ അതുപോലെ തന്നെ അങ്ങ് എഴുതി പഠിക്കുകയുള്ളൂ. നമ്മൾ ഒരു പേഴ്സണലൈസ് ചെയ്യുക. OET എപ്പോഴും പറയുന്ന ഒരു കാര്യമാണ് പേഴ്സണലൈസ് യുവർ ഇൻട്രൊഡക്ഷൻ, പേഴ്സണലൈസ് യുവർ റിക്വസ്റ്റ്. അതായത് ആരൊക്കെയോ എഴുതി ഉണ്ടാക്കിയ സെൻറ്റൻസുകൾ അതുപോലെ എഴുതി പഠിക്കുകയല്ല, നമ്മൾ നമ്മുടേതായ രീതിയിൽ സെൻറ്റൻസുകൾ ഉണ്ടാക്കുക. ഇപ്പോൾ ഇതിനകത്ത് ഞാൻ പ്ലീസ് കൈൻഡ്ലി ഒന്നും യൂസ് ചെയ്തില്ല. ഇത് OETയുടെ ലെറ്ററാണ്, OET എഴുതിയേക്കണ ലെറ്ററാണ്. അവരാണ് നമ്മളോട് സാമ്പിൾ ലെറ്റർ തന്നിട്ട് പറയണേ യു ഷുഡ് റൈറ്റ് യുവർ ലെറ്റർ ലൈക്ക് ദിസ്. മനസ്സിലായോ? അപ്പോൾ നമ്മൾ മിക്കവാറും പേര് OET പഠിച്ചു കഴിഞ്ഞാലും ഈ ഒരു ലെറ്റർ ഒന്നും കണ്ടിട്ടുണ്ടാവില്ല. അവരുടെ സാമ്പിൾ ലെറ്ററാണ്. ദാറ്റ്സ് ദ വേ ദേ വാണ്ട് അസ് ടു റൈറ്റ് ദ ലെറ്റർ. അപ്പോൾ നമുക്ക് അത് പേഴ്സണലൈസ് ചെയ്ത് എഴുതുക എന്നുള്ളത്. അപ്പോൾ ക്ലയൻറ്റ് പ്ലീസ് വെച്ച് എല്ലാ സെൻറ്റൻസും എഴുതിയാൽ മാത്രമാണ് റിക്വസ്റ്റ് ആവുള്ളൂ എന്നൊന്നുമില്ല. ഇതൊരു നല്ല വേ ഓഫ് റൈറ്റിംഗ് ആണ്. അപ്പോൾ നമുക്ക് അതിനകത്തേക്ക് ഒന്ന് മാറുക എന്നുള്ളതുള്ളൂ. എന്ന് വെച്ചാൽ പ്ലീസ് കൈൻഡ്ലി എഴുതണ്ടെന്നല്ല, എഴുതുന്നതിനൊരു കുഴപ്പമില്ല, ഇറ്റ് വുഡ് ബി അപ്രീഷിയേറ്റഡ്, എഴുതുന്നതിനും കുഴപ്പമില്ല. പക്ഷേ അതിനേക്കാളും നന്നായിട്ട് പേഴ്സണലൈസ് ചെയ്ത് എഴുതാൻ പറ്റുവാണെങ്കിൽ അത് കുറച്ചുകൂടി നന്നായിരിക്കും. ഇനി ആരോ കോഴ്സിൻ്റെ ഡീറ്റെയിൽസ് ചോദിച്ചിട്ടുണ്ട്. എത്ര മാസത്തെ കോഴ്സാണ് കാര്യങ്ങളൊക്കെ നമുക്ക് ഫോൺ നമ്പർ ഇതിനകത്ത് തന്നിട്ടുണ്ട്. നമ്മുടെ പേജിൽ കോൺടാക്ട് ചെയ്താൽ മതി. ഡീറ്റെയിൽസ്, ഫീസ് സ്ട്രക്ചർ കാര്യങ്ങളൊക്കെ അവർ നിങ്ങളോട് സംസാരിക്കുന്നതായിരിക്കും. Can we use connectives like despite, although, in discharge paragraph എന്നാണ് ബ്ലെസ്സി ചോദിച്ചേക്കണത്. യൂസ് ചെയ്യണതിന് ഒരു കുഴപ്പമില്ല. OETയുടെ ഒഫീഷ്യൽ സൈറ്റിൽ ഇത് യൂസ് ചെയ്യേണ്ട കാര്യങ്ങളാണ്, യൂസ് ചെയ്യാവുന്നതാണ്, യൂസ് ചെയ്താണ് ലെറ്റർ എഴുതിയേക്കുന്നതെങ്കിൽ വൈ വി കാൺട്ട്. മനസ്സിലായോ? അതായത് അവരുടെ സാമ്പിൾ ലെറ്റർ അങ്ങനെയാണ്. സാമ്പിൾ ലെറ്റർ എന്ന് വെച്ചാൽ എന്താ, ഇങ്ങനെയാണ് നിങ്ങൾ ലെറ്റർ എഴുതേണ്ടതെന്ന് പറഞ്ഞ് OET തന്നേക്കണ ലെറ്ററാണ്. അവർ റെക്കമെൻഡ് ചെയ്യണതാണ് ഈ ഡെസ്പൈറ്റ്, ഓൾദോ പോലെയുള്ള കണക്റ്റീവ്സ് ധൈര്യമായിട്ട് യൂസ് ചെയ്യാം. ലിബി ചോദിച്ചിട്ടുണ്ട്, ക്യാൻ ബി പുട്ട് ഡോട്ട് ആഫ്റ്റർ മിസ്റ്റർ എന്ന്. അഗെയിൻ ഡോട്ട് ഇട്ട് എഴുതുവാണെങ്കിൽ എല്ലായിടത്തും എഴുതുമ്പോൾ ഡോട്ട് ഇട്ടേക്കാം. ഇടാതിരുന്നാലും ഒരു കുഴപ്പമില്ല, ഇടണമെന്ന് OETക്ക് ഒരു നിർബന്ധമില്ല. ഈ ഡോട്ട്, കോമ പോലെയുള്ള പങ്ക്ച്വേഷൻസ് ഇറ്റ്സ് അപ് ടു യു. ആ കോമ സല്യൂട്ടേഷൻ കഴിഞ്ഞിട്ട് യുവർ സിൻസിയർലി കഴിഞ്ഞിട്ട് നിങ്ങൾക്ക് വേണമെങ്കിൽ ഒഴിവാക്കാവുന്നതാണ്. അതുകൊണ്ട് ഒരു കുഴപ്പമില്ല. ഇടുവാണെങ്കിൽ 2 സ്ഥലത്തും ഇടുവാം, ഒഴിവാക്കുവാണെങ്കിൽ 2 സ്ഥലത്തും ഒഴിവാക്കുക. അതുപോലെ തന്നെയാണ് ഈ മിസ്റ്റർ, മിസ്സിസ് ഒക്കെ കഴിഞ്ഞിട്ടുള്ള ഡോട്ടിൻ്റെ കാര്യം. ഇറ്റ്സ് അപ് ടു യു. ഓക്കെ. റെക്കമെൻഡേഷൻ ജോയ് ചോദിച്ചിട്ടുണ്ട്, റെക്കമെൻഡേഷൻ പാര യൂസ് ടു റൈറ്റ് പ്ലീസ് കൈൻഡ്ലി. അതിൻ്റെ ആൻസറാണ് നമ്മളിപ്പോൾ ചെയ്തത്. Could you please explain about how to use despite? അതൊരു ഗ്രാമർ സെഷൻ, അതിനുള്ള ഒരു സമയം നമുക്കിപ്പോൾ ഇല്ല. കം ആൻഡ് ജോയിൻ അജിനോറ. വി ആർ പ്രൊവൈഡിങ് ഗ്രാമർ സെഷൻസ് ആൻഡ് എവറിത്തിങ് ബിഫോർ യു സ്റ്റാർട്ട് യുവർ OET ട്രെയിനിങ്. ഡെസ്പൈറ്റ്, ഓൾദോ ഒക്കെ യൂസ് ചെയ്യണ പോലത്തെ കണക്റ്റീവാണ്. കുറച്ചുകൂടി ഡീറ്റെയിൽ ആയിട്ട് നമുക്കത് പഠിക്കാനുണ്ട്. ഒരു 10-15 മിനിറ്റ്സ് എടുത്ത് നമ്മളത് പഠിക്കുവാണെങ്കിൽ, യൂസ് ചെയ്യുവാണെങ്കിൽ ഒത്തിരി നന്നായിട്ട് യൂസ് ചെയ്യാൻ പറ്റിയ ഒരു കണക്റ്റീവാണ്. OET റൈറ്റിങ്ങിൽ നമുക്ക് എപ്പോഴും ആവശ്യം വരുന്ന ഒരു സാധനമാണ്. അപ്പോൾ അതിൻ്റെ ഡീറ്റെയിലേക്ക് ഞാനിപ്പോൾ പോകണില്ല. നമുക്ക് ഗ്രാമർ സെഷൻ വെച്ച് നമുക്ക് പിന്നെ ഒരു ഇതുപോലെ വീഡിയോ ചെയ്യാം. അല്ലെങ്കിൽ ഈ പറഞ്ഞ പോലെ യൂട്യൂബ്, ഇപ്പോൾ നമുക്ക് ഓൺലൈൻ റിസോഴ്സസ് ഒത്തിരി ഉണ്ട്. യൂസ് ഓഫ് ഡിസ്പൈറ്റ് എന്നൊക്കെ ഒന്ന് സെർച്ച് ചെയ്താൽ മതി. നല്ല ഇംഗ്ലീഷ് പ്രൊഫസേഴ്സിൻ്റെ ലെക്ചേഴ്സൊക്കെ കാണും. അപ്പോൾ ഒരു 15-20 മിനിറ്റ്സ് ഒക്കെ സ്പെൻഡ് ചെയ്താൽ നമുക്ക് അത് മനസ്സിലാക്കാവുന്ന കാര്യങ്ങളേ ഉള്ളൂ. അപ്പോൾ ഇപ്പോൾ ഞാൻ അതിനകത്തേക്ക് ഡീറ്റെയിൽ ആയിട്ട് പോണില്ല. ഇനി നമ്മൾ വൈൻഡപ്പ് ചെയ്യാറായി. ഇനി ആൻസർ ചെയ്യാത്ത ക്വസ്റ്റ്യൻസ് എന്തെങ്കിലുമൊക്കെ വിട്ടുപോയിട്ടുണ്ടെങ്കിൽ നമുക്ക് പിന്നെ അതിൻ്റെ ഞാൻ നോക്കിയിട്ട് പതുക്കെ ആൻസർ ചെയ്യാം. ഇനിയും കൂടുതൽ ഡൗട്ട്സ് ഒക്കെ ഉണ്ടെങ്കിൽ OET നമ്മൾ അജിനോറയിലെ ട്രെയിനേഴ്സ് എല്ലാവരും വി ആർ റെഡി ടു ഹെൽപ്പ് യു അറ്റ് എനി ടൈം. ഇപ്പോൾ നിങ്ങൾക്ക് ഇഷ്ടമുള്ളിടത്ത് നിങ്ങൾ അന്വേഷിക്കുക. നമ്മൾ പൈസ മുടക്കി പഠിക്കണതാണ്, അന്വേഷിക്കുക. എവിടെയാണോ നമുക്ക് ഏറ്റവും നല്ല റിസൾട്ട് ഉള്ളത്, എവിടെയാണോ നല്ല കോച്ചിങ് കിട്ടുന്നത്, നിങ്ങളുടെ ഫ്രണ്ട്സിനോട് അന്വേഷിക്കുക. അങ്ങനെയുള്ളിടത്ത് ജോയിൻ ചെയ്യാം. പിന്നെ തന്നെ പഠിക്കാവുന്ന റീഡിങ്സ്, ലിസണിങ് കാര്യങ്ങളൊക്കെ നമുക്ക് ട്രെയിനേഴ്സിന് ചെയ്യാവുന്നതിനും ഒക്കെ ഒരു ലിമിറ്റ് ഉണ്ട്. അപ്പോൾ തന്നെ പഠിക്കാവുന്ന കാര്യങ്ങളൊക്കെ തന്നെ പഠിക്കുക. പക്ഷേ റൈറ്റിംഗ്, സ്പീക്കിംഗ് പോലെയുള്ള കാര്യങ്ങൾക്ക് നിങ്ങൾക്ക് ഉറപ്പായിട്ടും ഒരു ട്രെയിനറിൻ്റെ ഹെൽപ്പ് ഉണ്ടെങ്കിൽ അതായിരിക്കും ഏറ്റവും നല്ലത്. അപ്പോൾ നിങ്ങളുടെ ലെവൽ അനുസരിച്ച് നിങ്ങൾ കാര്യങ്ങൾ ചെയ്ത് ഇൻസ്റ്റിറ്റ്യൂഷനിൽ ജോയിൻ ചെയ്യണമെങ്കിൽ ഫ്രണ്ട്സിനോട് അന്വേഷിക്കുക. എവിടെയാണ് നല്ല കോച്ചിങ് കാര്യങ്ങൾ അന്വേഷിച്ച് ജോയിൻ ചെയ്യുക, പഠിക്കുക. അങ്ങനെ എല്ലാവരും എക്സാം എഴുതി പാസ്സാകട്ടെ എന്ന് ആശംസിക്കുന്നു. നിങ്ങളുടെ ഒരു ഡ്രീം കൺട്രിയിൽ എത്തിച്ചേരാൻ എത്രയും പെട്ടെന്ന് സാധിക്കട്ടെ. ഓൾ ദി ബെസ്റ്റ്. താങ്ക് യു.
എന്തുകൊണ്ട് IELTS ആൻഡ് OET കോച്ചിങ്ങിന് 1,00,000-ലധികം വിദ്യാർത്ഥികൾ കഴിഞ്ഞ 9 വർഷമായി അജിനോറ തിരഞ്ഞെടുക്കുന്നു എന്നറിയണ്ടേ? അത് അവരിൽ നിന്ന് തന്നെ കേട്ടാലോ?
അജിനോറിലെ ട്രെയിനേഴ്സ് എല്ലാവരും നല്ല ക്വാളിറ്റി ഉള്ളവരാണ്. അവർ നമുക്ക് ഇൻഡിവിജ്വൽ കെയറും തരും.
അജിനോറയിൽ റെഗുലർ മോക്ക് ടെസ്റ്റ് നടത്തുന്നുണ്ട്. പിന്നെ ഓരോ സ്റ്റുഡന്റിനും കറക്ഷനും പറഞ്ഞു തരും. അങ്ങനെ നമുക്ക് പെട്ടെന്ന് ഇംപ്രൂവ് ചെയ്യാം.
നമ്മൾ പഠിക്കുന്നതിനനുസരിച്ച് നമ്മളെ ഫൗണ്ടേഷൻ, അഡ്വാൻസ്, പ്രീ എക്സാം എന്നിങ്ങനെ ബാച്ചുകളാക്കി കോച്ചിങ് നൽകുന്നു.
ഒരു എക്സാമിന് വേണ്ടി മാത്രമല്ല അജിനോറയിൽ കോച്ചിങ് നൽകുന്നത്, നമ്മുടെ ഒരു ഓവറോൾ കോൺഫിഡൻസ് തന്നെ ഇംപ്രൂവ് ആകും.
എക്സാം ക്ലിയർ ചെയ്ത് പ്ലേസ്മെന്റ് അജിനോറയിൽ നിന്ന് ചെയ്യുമ്പോൾ എക്സാം ഫീസും ട്യൂഷൻ ഫീസും രണ്ടും റീഫണ്ട് കിട്ടും.
That's it. Download Ajinora